Yes.
Okay. Uh, Thank you, Sahasra ENT Foundation, for having given me this opportunity and found me to be a legend and talk to my juniors about my journey of 40 years. I'm indeed very grateful to you. Uh, and I would also take this opportunity to, first of all, congratulate all of you on the Republic Day, our day today. I would also like to remember all my peer, right from my days of MBBS, my DLO, PGI, and the great friends I made in this journey. Um, and I must start by saying that there is a saying which says that legends are not made in a day. But I would try to correct this and say that legends are made only with blessings of God, without which it is just impossible to be a legend or whatever you do to do this kind of thing in your lifetime. The blessings have to be there, and I think that was the only difference between uh, uh, Kamli and Sachin Tendulkar, that Sachin had the blessings and probably Kamli did not have, but they were both great cricketers, in my opinion. So the blessings have to be there. And once again, I'm grateful to all my friends, my peers in the journey I traveled in these 40 years. I would like to divide my life as an ENT surgeon in two categories. One, before PGI Chandigarh, when I did my MBBS, my schooling, my DLO, and others, and one after PGI, because PGI Chandigarh, I think, changed my thinking about my profession, my inspiration in the profession. And when I was just about in the sixth standard, I remember I used to visit my village in Haryana, where I would meet this doctor who was loved by everybody. People would come and give him milk, somebody would come and give him vegetables. And he was a very dedicated doctor, very hardworking, very dedicated, and everybody loved him. And in my sixth standard, I said, no, I want to become something like him, where everybody would love him and he would also serve the humanity. Uh, that was how I started. And then, after having done my MBBS and DLO, uh, it was again blessings from God Almighty that I got into the most coveted PGI Chandigarh as an ENT postgraduate. And that was the most refreshing point in my life. I must tell you that uh, after I had completed my MBBS and my DLO, I had started feeling a little frustrated because I was working in a government setup. The things were not as good. The number of patients were overwhelming, too many to be treated properly. There was paucity of facilities, and it was drawing me into a kind of a funny depression whether I did the right thing to become a doctor. But then I was almost neck deep into my profession, and now turning back was just impossible. Not only because in India it is very difficult to change your professions like that, and secondly, my mother wanted me to become a doctor. And the blessings of my parents, uh, I had to go on doing what I was destined to do. Uh, After when I joined my PGI, this was again a very refreshing point in my life when I started getting all the best opportunities to treat my patients, to do the best which I could do. And here I would like to thank my teachers there, who not only taught me to become one good surgeon, but also a good doctor. And Dr. Pandi, I would name in particular, was a very great person in my life who helped me as an elder brother, as a teacher, as a good friend, and but then Dr. Mann, and I was really uh, very happy when I could honor Dr. Mehra, one of the best teachers in ENT in this world. I feel when I could honor him when I was the organizing chairperson of the third SIGI in Vigyan Bhavan, where I had called the great our president Abdul Kalam Saab as the chief guest, and I could honor my teacher there. it was a great feeling, great sense of satisfaction for me. Now, when I got into PGI, even when I was not liking to be a doctor, because I was not wanting to serve humanity, but it was such a painful, as we all know, we are all doctors, and we realize that it is such a pain to see the pain of your patients. And I was probably not made for that. I was no Mother Teresa. I was no. I didn't have the heart. Maybe I was an escapist like Mahatma Buddha, who left his family when he saw a dead body. And when he came back and his wife said, no, now I don't accept you because you went when I needed you. So I don't know what was right, but probably this inability to see the pain of the patients, and I'm a doctor, I have to see that, probably made me find something which I would love later on in life. And it took me almost like 45 years of my life to find what I actually liked in my life. So PGI made me a cancer surgeon, and it was very short-lived. Again, for the reason that I could not see the pain of those patients, the cancer patients, the no possibility of 100% result, we all know. And hats off to those people who are dedicated cancer surgeons, but somehow it was impossible for me. I took on to laryngotracheal surgery because I was operating the neck. I remember I used to finish up a laryngectomy in 1.5 hours, a maxillectomy in 45 minutes. So I was a good head and neck surgeon, so I took on to laryngotracheal surgery. But that also lasted only 6 years, because here also there was a lot of pain and agony, and it was not possible for me to continue seeing that in my patients. I became a rhinoplasty surgeon because I had worked with Dr. V.P. Sood, the legend Dr. V.P. Sood, and I worked for a few years. But then also this also did not satisfy me. And last but not the least, when I was 45 years old, I got into cochlear implant surgery, and I'm grateful to all the teachers who helped me get into this surgery. And today I can say that I not only treat, but I'm a happy person also because of this surgery. A very small surgery, clean surgery, and not only do you treat the child, but you get the blessings of the whole family and the whole society, because you've given not only hearing, but you give also speech to this child. And I think finally, at 65, I can say that the pursuit of finding something which will make me happy also, and also make me serve my patients, was finally a cochlear implant surgery. And now I call myself an inner ear specialist, where it is not only hearing, but balance which I look after. During my days, I'll just go that whatever I did with passion. And I'll just like to tell you how it all happened. When I was doing tracheal surgeries, I would pick up cases which most of the students or most of the surgeons would not pick up. And I would try to do that and try to help those who were being sent back by everybody. Now, this case, tracheal stenosis, was a large tracheal stenosis. You can see a tracheostomized 25 years old gentleman, recently married and then had a roadside accident. And there was a large tracheal stenosis there. And you can see the double tracheal tube in situ. We were giving the anesthesia from here, but the other tube was ready so that when we removed the area, we could slide this down and do the end-to-end anastomosis. And you can see the resection has been done, and the upper tube will now be slid down. 1/4 to 5 centimeters of the trachea removed by a laryngeal drop and mobilizing the other areas so as to get that tracheal length to do an end-to-end anastomosis. And you can see the upper thing has now been put down, and the stitches, extra luminal and extra mucosal stitches, pre-placed sutures given with the flexion of the neck, which gives you another 2.5 centimeters. This patient was done absolutely successfully. And you can see the tracheal airway, which was formed post-operatively. And this is the gentleman 2 years later. Though I had used a Sorensen's incision, there was a little keloid formation, but 4 to 5 centimeters of the trachea removed definitely made me very happy, and also made happy this gentleman. He was always grateful to me and would keep coming to me for almost 6-7 years before I left RML Hospital and came into practice. After that, he stopped coming. The second case I would like to show you during this period, which I did, was loss of anterior tracheal wall and the skin. This child had a bilateral vocal cord palsy, and he could not breathe, so they had done a tracheostomy, and gradually he repeated tracheostomies. He lost this anterior tracheal wall and the skin. And this patient came to me, another 23 years old boy, and I felt so bad that he had this hole here and he was not able to speak also. And I took up this challenge. He was refused by many a people, but then I took up this challenge and I said, I'll do your case. And this is how it looked like. And I started doing, I remember I had brought, when I was in Canada, I was working in the Sunnybrook Hospital, from where I brought the tracheal mesh, and I thought I'll use it in this patient, and I hope I did a good job, which I'd like to show you. The first thing was to open up the subglottic area and do a unilateral cordectomy. You can see the cordectomy has been done, and now the mucosal stitching would be done. And then the area was filled up with this tracheal mesh, and a T-tube was put. You can see that tracheal mesh is there. And then we covered up this tracheal mesh with, this is the tracheal mesh which I had brought from Sunnybrook Hospital in Canada, and I wanted to use it and do this case. And then the skin area was filled up with the deltopectoral flap, and it looked like this. And the third day, it was sheer happiness on my part and on the patient's part when he could speak by closing his T-tube. And on the third week, we detached the deltopectoral flap and the skin was there. And after 3 months, you can see even the T-tube was removed and the skin was stitched back to the situation. And this patient was absolutely all right. And he comes to me even recently. These are the few of the cases. And it was during this period when I used to treat these patients that sometimes we had to give them a speech valve. And the speech valve during those days, this I am saying about during the late 80s, the speech valve was very costly, and I invented the Hunt speech valve. This was a 150 rupees silver speech valve, which I had invented, and I gave it to all my patients who were on tracheostomy and on T-tube, and they were very happy. They didn't have to put their finger there to close and talk, and they could talk with this. They would breathe from here and talk from above. And this speech valve got lost in the thing because I left doing tracheal surgery, and then I got into rhinoplasty, and after rhinoplasty, I got into cochlear implant surgery. So I was changing this just because I was not getting that happiness. But whatever I did with passion and kept doing it. So the happiness was important because I wanted to do these things, and but I kept doing with passion also. Then came my stint with cochlear implants, and it was during the 1993 to 1998, all those 6-7 years, when I visited the House Ear Institute, the Children's Hospital in Toronto, the Ear Clinic in Würzburg, the Ear Hospital in Tokyo, and the Beinecke Institute in Melbourne. Again, grateful to God Almighty who gave me the, I could go to all these places through WHO fellowship and met all these stalwarts. The inspiration was Professor Graham Clark, the father of cochlear implants in this world, and many others. Dr. Nedzilski in the Sunnybrook Hospital, Dr. Dela Cruz in House Ear Institute, Dr. Pryman, and Dr. Graham Clark again. They were all a lot of inspiration to me, and I kept doing my cochlear implant temporal bone dissections and learned the posterior tympanotomy technique. And I was about to come back and start in my country the cochlear implants when I met my teacher, my soul, Dr. Trifon Karadzici from Veria in Austria. And he is like he's like my teacher. He's not only my teacher, he's my soul. He's my greatest friend, who not only told me that posterior tympanotomy is not the technique for cochlear implant, and he explained to me why. Because there is a lot of cochlear rotation which keeps occurring in children when we operate as children as small as 8 months, and it is not the right thing to do when you operate through the posterior tympanotomy, through the angle of the facial and the chorda, and try to reach that area of the round window niche and other places. And indeed, I'm grateful to this great man who changed my vision about cochlear implant surgery. And when he came to India, my first surgery, he just stood there. He said, "I'm there, but I have faith in you. You do it." And can you believe I did it right there with Dr. Trifon at the back? And I will always be grateful to what I am today, to this great man who taught me the real way of doing this technique. And you can see that instead of doing this large posterior tympanotomy and going through that pinhole, he told that we can do this surgery by creating a tunnel 1.4 millimeters and opening up the, going through the external auditory canal, and just a small little surgery. It is safe as far as the facial nerve is there, and also not needed. Such a large mastoid cavity is not needed. And I'll show you how beautifully and how easily we can do cochlear implant of different situations. And no parent or no buddy would like to have this kind of a thing vis-a-vis the Veria technique when you do this is the posterior tympanotomy, and you can see there is a large cavity which has been created. And particularly in a child, there is no business of connecting the mesotympanum, the eustachian tube, and the nasopharynx to the mastoid air cell system. So that is how I started doing. And this is the technique. And this is the instrument called the perforator, the Dr. Trifon perforator, by which we do this technique. And it just takes about 40 minutes to finish off this surgery, which normally takes about 3.5 to 4 hours to do. It is not the time, but it is the physiology of the mid-ear cleft which is important, which need not be disturbed when we are doing a cochlear implant. Please understand, it is like a cataract surgery. We put a implant there, we put a lens there. We're doing a pinhole of opening up the cornea. And here also, no physiology and anatomy of the mid-ear cleft is disturbed when we are doing this technique. So it takes a little time, and you can see the electrode goes straight inside without much handling of the electrode, and there'll be no problem as far as the surgery is concerned. So this surgery changed my perception about cochlear implant, which I had learned for so many years in different centers around the world. And this is the all which is done. And the magic instrument is the perforator, which you need to use with both your hands when you are doing the right and the left side. So this is what the surgery is all about. And I was the only surgeon from Asia in the conference we had at Israel, Dead Sea. And this is Dr. Trifon, my teacher, and this is me. I was the only Asian in that whole group that time. And now we have 70 odd surgeons doing the Veria technique just in India and in the SAARC countries. So any kind of situation, whether it is an anteriorly placed sigmoid sinus, a high jugular bulb, a distant cochleostomy, facial nerve dehiscence, you can see ossified cochlea and a drill out technique, a dehiscent jugular bulb, and taking care of the gusher, which many a times we see in these conditions because of large cochlear aqueducts, continuity with the internal auditory canal, which can be dealt with such an ease with this technique. So that is, and having done more than 3,000 cases, it was such a pleasure with no complications whatsoever. But that doesn't mean complications don't come. Also, these are the misplaced electrodes when you do through the different technique, the other technique, but I don't want to go into that. But it was as late as 2018 when the Cochlear Sydney guys called me and they wanted a scientific proof to this technique. And it was the Cochlear Skill Institute which called me to Sydney, and they made me do 2 temporal bone dissections. And you can see there were 50 people standing all around me to see how I do this technique. And then they did a histology, that is the temporal bone dissection which has been done. And then they did a histology of the bone to see that the facial nerve is far behind and the tunnel is at the right place where it should be. So now even histologically proved, and in the last 21 years by doing so many surgeries and being done by so many surgeries, I think it is proved beyond doubt that this technique was a great technique. But it took me a long time to convince people that this is a great technique. We had complications, but all those could be dealt with so much ease. That is a bad keloid which we removed and stitched it back. There is a big hematoma which has formed, and you can drain it. Please do it as early as possible. Don't wait, because if you wait, the hematoma would get organized and then you'll have to do a bigger thing. And if you wait further, you will get an infection. These are cases which were referred to me from other centers. But once you reach this stage, then you are in a fix and you will keep doing surgeries, but finally you will have to take the implant out. So that don't let ever these kind of situations come. If you are doing cochlear implant surgeries, they have to be done as early as possible. And once having done so many, then it was time to travel around the world, do cochlear implant surgeries at different places. This is Kazakhstan, Bangladesh, all over India, Pakistan, where I traveled and did this surgery and showed it to others that it can be done very safely. I lectured around the world and in SAARC countries. This is Pakistan, Bangladesh, Afghanistan, where I went and gave these lectures and did surgeries. Lectured in India. Almost all orations were finally given to me because now the technique was well accepted by everybody, and many people had started doing also. That is Dr. Meghnad in Hyderabad. That is Dr. Tufan, and we did that live surgery there also. Almost every kind of child which was done from around the world, America, Iraq, Nigeria, Afghanistan, from all over, and 8 to 10 implants in a day with this technique. So it was so easy that we could do so many implants in a day because of the short time taken by the surgery, and all very successfully done. So it was a beautiful technique, and I could do that in all these centers around the country and in SAARC countries. Then came the angel in my life. Dr. Abdul Kalam Saab, the President of India, just read about an article about this technique in the newspaper. He called me to his office. He wanted to know what this is all about. And he asked me to bring some temporal bone things also, and my laptop to tell me how this is all about. And then whenever he would have a discussion on cochlear implants, he would call me. And then he put me in the indigenous cochlear implant program, the DRDO implant program, where I did the animal trials for him. And then at Vishakhapatnam, when the implant was made, he had called me there to all those who were part of this thing. And it was a great journey with him, to be with him and to do this indigenous implant thing. And then in 2005, he honored me with the Padma Shri. It was such a blessing to have taken the Padma Shri from him. It was a great feeling. And then the Prime Minister, the Chief Minister of Delhi, Chief Minister of Chhattisgarh, they all honored me. This was the Chhattisgarh Ratan Award, which I got from the Chief Minister of Chhattisgarh for having done 150 implants government program there. Then doing the international, I got the International Rotary Award in Dubai because having done many cochlear implants for the Rotary Foundation, that was a great honor which I got. Then I was honored as the chief guest and made the Professor Emeritus to Vaidehi Institute, Bangalore. This was a great honor again. And you can see the honor which I got from everybody. Journey continued, and the blessings which came from Pingalwada. I must tell you a little about this, that it is Dr. Inderjeet Kaur, she is a doctor herself, and Dr. Jagdeepak. One day they called me and said, Dr. Hans, we would like you to do cochlear implants in the third floor of a deaf and dumb school. We will make an operation theater here, and you will have to do. I said, yes, I will do it, because I was sure they will not be able to make an operation theater there. But hats off to Dr. Jagdeepak. Three months later, he calls me and says, Dr. Hans, the operation theater is ready, and we have 3 cases, and you'll have to come and operate. And since then, we've been operating every 6 months, 3 to 4 cases in Pingalwada on the 3rd floor of the deaf and dumb school, where he created a beautiful operation theater, and where people donate money for cochlear implants, and we do it free of charge there. Hats off to Dr. Inderjeet Kaurji and Dr. Jagdeepak for having done a marvelous feat. And this goes in my memory as a great achievement in my life. So I thought I'll just tell you about that. The greatest gift of life comes when a small little child starts talking.
Medicine.
So you can see how happy I would be feeling when a child wants to mimic you and wants to become like you. I had operated when he was 15 months old, and now, God's grace, is doing very well. I would also like to congratulate his mother here, because she's the one who did the speech therapy for him to bring him to this situation. So it's been a great journey for all these parents. And now every year at Innsbruck, we have a workshop. Me and my teacher, Dr. Trifon, we teach this technique to 8 students, 4 from India and 4 from abroad. And every year, this last year we could not have it because of COVID. God willing, we will have it in the years to come. And it's been a great thing to teach many more students this Varia technique, and the happiness it gave me in my journey in the last 40 years. And now, lastly, I would like to tell you that Dr. Hans Center in Delhi is a state-of-art 5,500 square feet center for cochlear implant. And we have an auditorium with 50 seats. We have a temporal bone lab where people come and learn. We have an AVT room, a mapping room, an audiology room, everything which caters to hearing loss. And now, because I also have a vertigo clinic, we have a beautiful vestibular lab where there is a vestibular habilitation center also. And we have 3 areas where we give intratympanic drug therapy with very good results. So now I call myself an inner ear specialist with hearing and balance. It gives me again very happy. This is again a very a small area where vertigo, which is a very difficult situation, but if you treat these patients properly, scientifically, you can really get their blessings and be happy. So something which I wanted to be happy in the profession which I have chosen, by mistake or whatever, by I was 6 years old. I was in sixth standard when I requested God to make me a doctor, but then realized it was difficult for me to see the pain of these patients. And then gradually I kept changing till I got into what I do today. And not only I get my inner happiness, but also I treat these patients and get their blessings. So last but not the least, something which I did not miss all these years is my golf. Not only good friends, but also good girls around me. This is Lisa Ray, all beautiful girls, so that keeps you happy. So whatever you do in life, do for your soul, be happy, and do your best. Because if you don't do your best, then you won't be happy. So my message for today is you have to keep doing your best and leave rest to the God. Because finally, if you have done your karmas well, God will bless you with the best of life and happiness in life. Thank you very much. And I hope this could inspire my young students to learn what life is all about. You have to find happiness in what you do. Sometimes it cannot just be there, but you try to find, if it is not possible, that keep changing in whatever you're doing, keep changing till you find happiness. So you can imagine that till 45 years I was changing. And at 45, I started learning cochlear implants. And it is now 21 years. I've been doing cochlear implants, and I find myself a happy person and also a blessed person for all the blessings of these patients, the parents, everybody makes me even happier. Thank you very much.
Thank you, sir. That was really an inspirational speech. Yeah, some almost a 40 years journey in 30 minutes. As you said, age is just a number. Learning never stops. So I would like to open audience, and if anybody wants to interact, you can unmute and discuss with the professor. Any questions from the audience? Will Sir, one question, sir. What did you advise for the youngsters to start cochlear implant?
Oh, you have to be with a teacher who teaches you the way it should be taught. You have to be, and don't hurry up. Please take some time, because any surgery for that matter, it was cancer surgery I started with, whether it was laryngotracheal surgery, rhinoplasty. I remember I'd worked with Dr. VP Sood, who was doing great rhinoplasty surgery, and he used to put so much time in what he was doing, and it took us a long time to learn that. So anything to put in a lot of time, lot of dedication. So this is important. This is very important. You have to keep doing with that sincerity. It will take time, but don't hurry up. I remember I'd gone somewhere to operate when this doctor tells me, "Sir, I saw your video last night and I think I can operate on this child." Please don't do this. Is surgery. You have to practice it on the temporal bone very sincerely, and you have to be with your teacher for a long time. Unfortunately, Dr. Trifon, when I started this in this country, Dr. Trifon used to come, but he could not come every time. So I learned it the hard way. And that's the reason why I keep telling my students that please do it the way I do, because not that I'm always right, because I've been wrong many times. So in that journey, I did many things which I had to correct myself. So if I'm teaching, I would like that my students don't do that, don't go through that pain of learning and doing something wrong. So it is, as a father tells his son, "Son, do as I tell you, not because I'm always right, but I've been wrong many times and it pained me. So my request to my juniors would be, and there have been, I have had very good students. I remember Dr. Rohit, Dr. Vasanti, Dr. Satyaprakash Dubey, and now Dr. Vishal. Many such students were there, Dr. Sampurna Ghosh, many of them who are learning the beautiful way. They are very patient, they take time, and believe you me, any surgery for that matter, you have to take time to learn. You just can't say that I saw your video last evening and now I can operate it. You have to do temporal bone dissections, and then once you have come across most of the problems which you can face in any surgery, you will be a master one day.
So Dr. Anila was asking reason behind
Reason behind?
choosing ENT.
Oh no, that was again a, a misconception. I must tell you. You know, you accidentally conceive and you have to give birth to that child. Sometimes it isn't like that. First of all, I tell you, I started feeling sorry why I became a doctor, because I wanted to become either a golfer or a wildlife photographer or a painter for that matter. But because I took up this profession, and then I had to be in this. That's why I kept changing. The pain I could not see in my patients. Cancer was quite painful, not only for my patients but also for me. And then I kept changing. So ENT was not my choice. My choice was eye. But then once I am into it, I have to see the best in that. That is my advice. Many a times you get into a situation where probably you didn't want to be, but you are now. But if you keep finding what is the best for you, one day you will get into a situation where you will start loving what you are doing.
Yes, sir. Cochlear implant, running a cochlear implant surgery is a dream for ENT consult. So can you answer?
Please come again. I could not get you properly.
Sir, yeah. So learning cochlear implants is a dream for ENT graduates.
No, I don't think anything is a dream. I can say cancer surgery is even more difficult. I remember when I was once with uh, Dr. Tapaswini. She was my junior, and I used to tell her I don't like cancer surgery. She's a very good cancer surgeon, and I would say I don't like cancer surgery. So much of hard work in that. Believe you me, in cochlear implant, it is just about 40-minute surgery, and you getting all the laurels in the world. Cancer surgeons are very dedicated people, very hardworking people. Hats off to them. But uh, you know, you have to master what you are doing. That is important, and uh, uh, that is my advice to my juniors. Master whatever you do, whether it is cancer surgery, whether it is laryngotracheal surgery. There are some fantastic rhinoplastic surgeons in India, and they're doing a very great job, and they're very happy. So keep doing till you are happy. Cochlear implant is not a big deal. Please, I can tell you, stapes surgery is sometimes more difficult than a cochlear implant. Just because there's a lot of money involved in this, it probably looks very, uh, you know, big and difficult. No, it is not difficult at all. Those people who do it, even with the posterior tympanotomy, they do a great job. They do a fantastic job. They give very good results, but they have mastered it. That is important. That is my advice to all my juniors. Master whatever you are doing. Don't hasten. Don't hasten up. Don't try to be, this is, you are operating children as small as 8 months old. They are somebody's children, and these parents come and give you all the money and their child to operate upon. Be conscientious. Try to do the thing very nicely. Don't hurry up. That's my advice to everybody.
Yeah, true, sir. Yeah. So, any audience? Dr. Trifon Kirans is trying to.
That's my teacher. Please bring him in.
Sir.
Good evening, sir. Hello.
Hello.
Yeah, doctor, sir. Yes, sir. Please tell. It's so nice to have you.
I'm sorry, I can't hear you.
No, we can hear you, sir. Please say something.
I'm very happy to meet you. I'm very happy. I was very happy to enjoy your lecture, Hans.
Thank you, sir. Thank you very much. Thank you very much. And it's such a
very detailed, described everything.
Thank you, sir. Thank you very much. And
I
I'm happy that you're there, sir.
I enjoyed it very much.
Thank you, sir. Thank you.
I'm looking forward to meeting you again.
Yes, sir. We will maybe in India or in Innsbruck. I think we'll have to start the Innsbruck program once again.
Yes, after this coronavirus thing.
Yes, sir. Once we are vaccinated, all of us, I think we'll start again, sir.
Today I had the vaccination.
Yes, sir.
Today I had the vaccination.
Oh, so I think now we can do it. We can do it as early as possible. That's my teacher, Dr. Trifon. He's my soulmate, I must tell you that. He used to come from all the way from Varia, where he invented this technique. Varia is the place where he lives. And that's why we call it the Varia technique. So he started, and I was the first to do it in India. And he would come every time when I needed him. Thank you very much, sir, to be there in my life, sir. What I am today is because of you.
I'm very happy to have met you also, Hans.
Thank you, sir. Thank you very much, sir.
You are a very nice and very exceptionally able person.
Thank you, sir. Thank you very much.
Yeah.
Thank you, sir.
Best regards to all of your friends.
Thank you, sir. Thank you. I'm happy that I could take your teaching to that level in India.
I'm happy too.
Thank you, sir.
Okay.
Thank you, sir. Thank you.
When is the next session?
Which session, sir?
When are you going to organize another session also?
Yes, sir. The one we did last year, I think again we will have it shortly once the COVID in India. I think COVID in India has been taken care of well, but we will have it as soon as possible. So
I mean this web.
Okay, sir. I think we can tell these Sahasra guys they can have a very good session on cochlear implants because they are the best in organizing webinars in ENT in India, sir, and everywhere in the world. They are
who is this?
Sir, they're the one who did this. My this thing webinar today. This is Sahasra ENT Foundation, sir. They are the best in India who do virtual workshops.
Oh, very nice.
Yeah. We can request them to have one on Varia as a lead soon, sir.
Okay.
Sir, we will definitely honored to organize stuff here, sir.
Okay, very nice.
Thank you, sir. Thank you.
Bye-bye.
Thank you, sir. I think somebody is asking about how to have fellowships under me. You can come anytime. The only thing is that we don't get real temporal bones in Delhi. So you have to do it on fake-on bones. So I have these two temporal bone labs in my center. And anybody can bring the fake-on bones and try out these technique, and they can assist me. They can stay with me for 2 to 3 months. Like 29th and 30th, we have 4 cochlear implants, and Dr. Sampurna from Hyderabad is coming to attend that. So my students keep coming to me, and she calls me to Hyderabad also We have done about 6-7 cases with her in Hyderabad. I was recently in Dehradun, where Dr. Tripti, she's the HOD ENT there, and now she started doing cochlear implant herself. And I just stand there with her when she's doing, and she does a beautiful job. So earlier, before the COVID, there were about 10-12 centers where I used to go. Now it is difficult, but still I've started going again. And whosoever wants to call me or want to come to me are welcome, really.
Thank you, sir. I think we had a really great 40 minutes talk has inspired a lot of graduates, consultants, and everyone to host you again on a.
Thank you.
I'll talk to you, sir.
And I must congratulate you, Sahasra ENT Foundation. Everybody tells me is one of the best foundations doing this job in India and abroad. You almost cover the whole world. Congratulations in starting this program, and hats off to you. You're doing a great job.
Thank you, sir. Thank you, sir. Your blessings.
Thank you.
Good night. Good night, all.
Thank you. Thank you, everybody. Thanks for being there. Thank you.
Good night. Good night.
Thank you, sir. Thank you.